counts. I'm trying to share with you today for the 4th or 5th time what we have learned from a very peculiar specialty, and that is to take care of patients who are basically beyond medical help. This, I hope, will never become a subspecialty of medicine. I think there is a great danger that this is en vogue now. Everybody writes books on death and dying and gives workshops and lectures on death and dying. And I think one of my concerns is that we are developing a subspecialist who is then called in to take care of patients when they are beyond medical help. What I'm sharing with you is not meant for a thanatologist. What I'm trying to share with you is what we learned from our dying patients who taught us many lessons, not only about dying, but really about living. They taught us things that are important for you, whether you're a physician, a psychologist, a counselor, a chaplain, or a nurse, or simply a family member who is in the process of losing a loved one. We started this work about 10 years ago by what we at that time considered chance happenings, when some theology students were asked to write a paper on crisis in human life and thought that dying was the biggest crisis man had to face. This led to a meeting and to a realization that we really know very little what it's like to be dying, and that we could ask dying patients to be our teachers, to share with us some of their needs, fears, and fantasies, but most important of all, that they are perhaps the only people who can tell us what kind of things we can do that is going to help them in this final difficult time. We interviewed hundreds of grown-ups in the last few years. I have worked almost exclusively with dying children, and I'm going to combine a little bit to simply share with you the highlights of the lessons we have learned from these people. One of the first impressions we had is that the staff and the family, but especially the staff who works in hospitals, where about 75% of our patient population has to die, is very uncomfortable with dying patients. There was a tremendous denial that anybody even dies in our hospital. There was a tremendous difficulty in even getting permission to talk to dying patients about dying. When I originally looked for patients to be interviewed, I received the same answer on every floor: nobody's dying on our floor. And I was naive and went to the next floor, same answer, until I covered the whole 600-bed hospital. And then only dawned on me that maybe the staff has a problem. That proved to be very true. When we finally got to the patients, we were very moved how welcome we were, how very eager patients were